UNICEF estimates that 1 in every 3 girls have experienced physical or sexual violence during their lifetime. Healthcare workers such as patent and proprietary medicine vendors are often first responders to sexual and gender-based violence-related injuries, providing urgent medical treatment and emergency contraception. This is why the Cece Yara Foundation, a child-centered NGO, recently trained patent and proprietary medicine vendors (PPMVs) and pharmacists on appropriate response and care to child survivors of sexual and gender-based violence. The maiden capacity building workshop tagged First Medical Responders Training was also in commemoration of the World Contraception Day. The experts said that the training was pertinent to strengthening national and global efforts in combating sexual and gender-based violence.
In our years of operation at the Cece Yara Foundation, we have given support to children and women who have been sexually assaulted. And in the years that we've worked, we've seen that a lot of abused survivors have identified PPMVs as their first responder to sexual assault. I mean, when an individual is abused, their first instinct is to go to a pharmacy. Now we've realized that these people are first responders to health cases when it comes to SGBV, and we've taken it upon ourselves to see that they are trained appropriately in knowing how to respond to sexual and gender-based violence. At the end of the training, what we expect is that they have capacity to understand how to refer cases of sexual and gender-based violence to the appropriate organizations. For example, the Cece Yara Foundation. It's not only for them to get the medical attention that they require, but also to get access to other services that we have that we provide, such as legal aid, such as psychosocial support, such as shelter. So what we've done today is to empower them.
One of the first things that needs to happen is you need to first prevent the abuse from reoccurring, right? If you nip it in the bud, the earlier you nip it in the bud, the better chances you have of getting a better outcome. So, which is why we're actually here, because the PPMVs are the people in the communities. They're the ones who know those people. They're the ones who interact with these people on a daily basis. So it is important, that they're in the fight. How can we prevent them? I think early recognition, early treatment will also help.
This program is something we've always wanted to do, and it's a way of ensuring that survivors of rape and sexual violence have access to first responder care. And working with the proprietary patent medical vendor ensure that survivors of sexual and gender-based violence can have access to first-line care, which is access to medical treatments and forensic medical examination, as well as medications or screening for sexually transmitted infection, to ensure that they do not have complications resulting from sexual and gender-based violence.
Actually, there is no data to the number of abuse or abuses we have in our community. We just at times we stumble on them. They come to you by their behavior, the way they come, and somebody wants to buy Postin or two or emergency contraceptive pill, and they'll be, coming, she will come, she will go later, say, okay, please give me that thing where they prevent belle. You understand? So we have cases like that, but there is nothing to, no reporting system. So from this seminar today, I think I will need to do more.
Over 100 participants were present to listen to health experts and clinical psychologists on how to respond and identify signs of sexual and gender-based violence in children and refer them to relevant organizations for appropriate extensive care.